Well, varicose veins, again, are those large bulging veins that you see on your skin. And typically they cause aching or heaviness or throbbing or pressure and leg pain. Most of the time when you see varicose veins, there is a vein under the skin that is responsible for causing those varicose veins. There's venous reflux or blood going the wrong direction in usually the greater or lesser saphenous vein, and that blood going the wrong direction puts pressure on those veins and makes them dilate. So the first thing that we usually do is an ultrasound, a duplex ultrasound. Ultrasound has revolutionized vein treatment because we're able to identify the points of reflux or where the problem starts. If the saphenous vein is incompetent, then we do a catheter procedure. We use a radiofrequency catheter at this point. That entails putting a catheter inside of that vein using ultrasound guidance. The catheter then closes the vein, stops the blood from going the wrong direction, and symptoms get better. Most people are able to return to work the following day. If they have a very strenuous job where they're lifting 100 pounds or more, I might ask them to take a day off. That's in contrast to stripping. When surgical stripping was the treatment of choice, patients missed work a minimum of a week and oftentimes 3 or 4 weeks, depending on the stresses of their job. After a radiofrequency ablation, the symptoms usually improve. If there's ankle swelling, that's usually better. If there's pain or throbbing, that's usually better. The visible varicosities will get smaller, and the longer you wait, the smaller they get. Occasionally they disappear, but most of the time, if you're going to completely get rid of the varicose veins that are visible, you're going to need another treatment. And there are 2 options for those treatments. One is ultrasound-guided sclerotherapy, which again is injecting medicine or foam that we make from that medicine into the vein. The vein is irritated, closes, and your body absorbs it. That absorption period can take a few weeks up to several months, depending on the size of the vein. The second option is to do an ambulatory phlebectomy, which is making a small incision. Most of the time I don't even use a scalpel, I just use a needle, reach in with a small hook, grasp the vein, and pull it out through the skin. So for the 2 treatments for the residual varicosities, there's a good way of looking at it. Ultrasound-guided sclerotherapy is a simple procedure. It entails 2 or 3 needle sticks usually. The good thing is the procedure's fast and easy. The downside is it takes a while for those veins to go away, and there is a risk of discoloration along the path of that vein. It doesn't happen all the time, but when that does happen, there's not much I can do to make it better other than say, be patient and it'll go away, and it almost always goes away. A phlebectomy is a bigger procedure. On the day we do that, the only uncomfortable part is using local anesthesia to numb up the skin. Should the patients desire to go to sleep, we have the option of doing this at a surgery center. The good thing about a phlebectomy is when the procedure's done, the vein is gone. Patients usually do not need pain medicine for either procedure. The biggest complaint I get is having to wear the compression stockings no matter how I treat them. Varicose veins are not life-threatening. You'll never die from varicose veins. There is a small increased risk for developing blood clots from having the presence of varicose veins. Sometimes that scares people, especially if they've had a family member that's had a blood clot in the past. Untreated varicose veins will always get worse. Our primary interest is in taking care of the patients, whether they end up needing treatment or not. So we try to treat each individual as a person, respect their time. I don't overbook my office. Patients rarely wait more than 5 minutes in the waiting room before being brought back to see me. The staff will individually greet you. I will see every patient for their initial consultation. We try to make it comfortable and easy and not waste your time. So the appointment may take a while, but you should never be sitting in our waiting room for very long.